Hello, friends. Hope everybody is fine. We all know that the May month every year is being celebrated as the Mental Health Awareness Month. And so we, doctors from different places in the world, decided to come together to just talk and see how we can take this further. The Mental Health Awareness Month started very early, and the idea being that the stigma behind the mental health, to eradicate that in order to promote the mental health challenges which so many people are facing across the world, and also to empower the family and relations so that they can be the people who are actually suffering from mental health, they can be guided. So with that, I would like to introduce my friends, Dr. Cecilia Fernandez, who is from USA, Dr. Kriti, who is from Europe, and they will introduce themselves when we start speaking. So, first question I would like to ask Dr. Cecilia that what exactly, when we say there is a mental health issue, what exactly is mental health? Can you throw some light on it and introduce yourself also? Thank you.
So, hi everyone. Thank you for this opportunity, Dr. Gupta and Dr. Kriti Nanda, to come together. So, I'm a pediatric neurologist. I have been trained in both neurology and psychiatry and board certified here in the US. I take care of young children, see a lot of mental health issues with them in clinic, but also get to an opportunity to interact with their parents and young adults. So I have been, privy to this situation for quite some time. And especially post the pandemic, we are seeing a huge rise in mental health concerns. Now, what I think, everyone needs to understand is physical health, mental health, emotional health, spiritual health. These are all domains of a person's entire well-being. We cannot separate it into one bracket or another bracket. If you break your leg or if you have high blood glucose, you are going to see a doctor. Similarly, with our emotions, we often feel that that is something that needs to be dealt with separately, but it's not the case. We all know that emotions actually come from the brain. So mind and brain are one organ. And that's where mental health people need to understand that mental health is not separate. It is part of your physical well-being. It is part of your holistic well-being. And that's what mental health is. You can define it as part or a domain of your well-being, your health. And it is defined by all the emotions that you experience, your mental state and how you are feeling on a day-to-day basis. What is the quality of your thoughts? Are they positive thoughts, negative thoughts? That's the way you can help to identify if you are really having an issue internally. And expressing that is extremely important. So that's how I would say, Dr. Gupta, that's what we see in the clinic and how we know that someone may be undergoing a mental health concern.
Great. Thank you so much for that beautiful understanding about our mental health. With that, to Dr. Kriti, I would like to ask that you see patients with mental health issues. So, what exactly you do? How do you connect to them, or how do you converse and deal with it? If you can throw some light.
Thank you. Hi, Dr. Santosh. Yes, I am working currently in a clinic in Zurich, Switzerland, and mainly as an internist with a specialization in psychosomatic, psychosocial medicine, and mental health. So it goes in that direction what Dr. Cecilia was mentioning about, how our psyche, how our mind, how our body are interlinked and connected. This is psychosomatic, basically, how things that happen within us, on a psychic level, on a mental level, when we feel internally, emotionally low, disturbed, how the body reacts to that. That is psychosomatic medicine. So the thing is, when patients come, so back to your question, it's the most important bit is to listen to them first, because many, as you mentioned, they have that fear of being stigmatized. Sometimes it's still a taboo. It depends on the cultural background also. But the first important bit is to encourage them to actually open up. And sometimes it happens that, they come for something else and you just have a feeling, they chronically come for the same issue. and you have done all the tests and diagnostics, and you know there is more to it. So to also from your side, from a medical perspective, talk about that. I think that's something which is also interesting for all our, members or friends from the medical fraternity, to encourage, the patients, to ask them how are they doing, emotionally. Do they feel stressed? Because that's one of the major risk factors also for the development of mental health issues. So just being there, listening to them, encouraging them to open up is one important step. Then once they, open up, then we also need to have the time, which obviously sometimes it's limited, but we need to be there because these things, patiently we need to be there and listen to them. And then it's important to assess that is it something which is, severe, which needs further, specialized assistance and help, to a referral to a psychologist, to a psychiatrist, medical treatment, or is it something which can be treated in the clinic? And then I try to see the patients regularly, every 1 to 2 weeks. And we talk about the different aspects, what Dr. Cecilia mentioned, right? The physical aspect, the emotional aspect, the mental aspect. And what I always try, and what a patient also really, I think, appreciate is to see that in a holistic way, as we were mentioning before. So it's not just, the thoughts, it's everything together. And also the spiritual level is something which I find really, really important in today's time. I mean, we know there are also, research studies on that people who spiritually are active or who engage in spiritual practices, that this is kind of a protective factor for the development of mental health issues. So just, ask them what is their understanding of spirituality. And this basically is next to the physical, mental, and emotional layer. I also try to incorporate the spiritual one. And it's very interesting because people are very open to it, actually. So I think it should be talked more about. So this is kind of my approach. So yeah, but I don't know how you feel about it, or what is your feeling that we can help, or people can help their friends, their family, because now with the numbers rising, like 3 out of 5 people globally feel overwhelmed with the tasks at hand, and we know that depression has become the kind of disease with the highest global burden. So everyone, also from our friends who are listening, everyone will have someone in the family or in their friend circle or at work who is affected, or maybe is affected themselves. So what would you think, Suji or Mr. Santosh, would be, the best way to help family and friends to with mental health conditions?
Yeah, so thank you for that question. So, from Indian perspective, first of all, I would like to highlight one very important thing, that in India, still a stigmata. There's a stigma behind mental health. So, the moment somebody is diagnosed, the whole family tries to keep it hush, and they try to isolate that person, which is actually, as we all know, worst thing to be done for these kind of patients. Uh, One another thing before I would come to the your actual answer, to make one realize that in India the mental health burden is really increasing. In fact, World Health Organization has alarmed India especially because the number of suicide cases, especially amongst the youth, has drastically gone up during COVID and post-COVID compared to other countries. And of course, we know that similar things are happening in other countries as well. Here, a very important thing to understand is that when we look from a cultural background like India, where we see that when patients are already having uh, an issue with accepting that you are actually going through a mental health issue, that itself is the biggest block. So first step is to accept. It is very important to accept, and here a counselor or a person who can guide properly is needed. So India being such a vast country with so much population, there is definitely a dearth of medical health workers, the psychologists and psychiatrists, with the ratio between population of mental health issues and doctors. So very importantly, we need individuals who can come, who can get trained and support such people, which is very, very important. Most important thing is that we need to understand that it is not just a medical treatment. Of course, medical treatment is a must, as depending upon the condition, to take appropriate medicines and whatever therapies which are there. Apart from this, a very important part, which is your question, what your question was, that to how to address it, is a holistic approach, which is the most important thing. So we are not just this physical body, but we are also this mental, emotional, and a very deeply engraved part of our being is our spiritual core. Human being, as we all know, is a social animal, and we need to interact with society. We need to interact with people around. So all these aspects, all these aspects together need to be covered when we talk about mental health. So apart from the actual medical treatment, which is a must, there is a very important thing to address. How does one connect to that source? How does one connect to one's own true self? And here I would say spirituality really plays a very important role. This is something, again, a very important thing to understand, that how do we open this? Because spirituality is completely based on faith and one's own inner beliefs, which we cannot tell or teach people. So this is something which will only happen when society brings in children with those values, to understand your true core, to be able to connect to that source, and bring up those very basic values which were there in our ancient tradition all over the world. So once that faith is developed, it is very easy to fall back and hold to that faith. Again, we all know that all psychologists and psychiatrists eventually will tell everyone that you need to have that strength from within, and that strength from within multiplies 1,000 times, I would say, when you have that faith in that source, when you believe in that. So that is one of the very important factor, I would say.
Yeah, it's
So I would
interesting that you bring
go ahead.
that up. Dr. Santosh Gupta, it's interesting that you bring that up because, when I see here, especially in the US, our epidemic is actually deaths from fentanyl overdose right now. So, and if you look at the root cause of that, somewhere it is linked to mental health as well. So a lot of our addicts, or you would say those who are reaching out even to try to use softer drugs, you would call it, versus the hard drugs, it is all somewhere a lack of that social connection, like you brought up, that emotional bonding and really knowing your true self. So a lot of people are caught in this circle or cycle of their low emotional state. And if you talk to these people, really it is, they're trying to escape from something. So some of the leading psychologists in the country and psychiatrists have often been trying to use methods for trauma healing. We all know trauma healing is a very big part of it. And this is such a good evidence for us, even if we may not have a lot of research articles. It's a good evidence to show that trauma healing addresses something within your spiritual core, within your inner being, within your true self, and bringing you back there. So again, highlighting the importance of, one, breaking the stigma, second, acceptance, but also knowing that this cannot happen only limited to medications and therapy, because even that, you have a limitation. We have to go the whole 9 yards if we want to, as a society, move towards a more healthy society. We have to look at every layer of the being. So yeah, thank you for bringing that up.
Thank
I
you.
think
That
to
was
tackle,
really wonderful.
yes, I completely agree. I think to tackle this kind of pandemic, this new mental health pandemic, which is there over like globally, and I think it was by the WHO, it was predicted that by 2030, depression and burnout will be the number one health issues. So I think that we need this holistic approach, and it's not about not taking the medicine or not taking the psychotherapy. It's about doing that along with something else which addresses different layers. And this is the way I always explain it to the patients. And I think it is also logically, it makes sense. Even if we think that spirituality is more, of an experiential dimension, that we touched upon. But even logically, it makes sense that we have different aspects within us, and some things are just beyond that what the conscious mind, can grasp. So we need to address it at that level, which is then more, you may call it an energetic level or spiritual level, that then depends. But it's really not about excluding something. It's more about putting an and instead of an or. So I think we will need something more inclusive for the future. And I think in the US energetic medicine, there's really good research being done in that case as well. So, Dr. Santosh Gupta, what do you think spiritual processes? What kind of power, or what kind of significance could they have in this mental health topic? Also taking into consideration, the people will say that how can you prove it, because it's something experiential. And yeah, maybe you can also share about the study that were already been done.
Yeah, very good question, and one of my favorite topics. So we all know that like mental health itself is a stigma. There is a feeling amongst the intellectuals about spirituality, kind of a stigma that, how can that help in actual medical condition. I'm sure you all know, but to all our listeners and viewers here, I would like to very emphatically tell this that a huge amount of research is has been done over last 10 to 15 years of how spiritual practices, when I say spiritual practice, it could be a meditation or a spiritual process, how these are actually helping in mental health disorders and from all over the world. And they have documented with evidence-based science, with proofs and with repeated research studies by different methods as to how they bring about changes in one's entire being. They bring about changes in the brain connectivity. There is a very amazing understanding of what is called as neuroplasticity, whereby areas in the brain which were actually supposed to take care of certain parts, when they get damaged, other areas in the brain they take over. And this is something which is also described as rewiring the brain. So if you see a person who is having a mental health disorder, which could be anxiety, depression, schizophrenia, bipolar disorder, and so on, what has been found in functional MRI brain connectivity, which we call as resting state functional MRI connectivity, the default mode network, the wiring of the brain, I'm using a very gross term, but the connectivity of different areas of the brain is different. And in order to bring it back to normal, what has been documented is that spiritual processes, practices, meditation, they really help. This has been actually scientifically proven. And just to help everyone to understand that we have been, all three of us have been part of this research where we had actually tested participants. Initially, we did on volunteers, where we did their brain functional MRI, resting state functional MRI, and demonstrated how, after a specific spiritual process, which is called as Maitri Shakti Prava, which is a gift given to us by the founder visionary of Maitri Bodh Parivar, Maitre Dadashriji. So this is a very powerful energy transfer process, which on functional MRI showed that there is an increased connection in an area of the brain called precuneus. Precuneus is a part of default mode network, which is an emotional hub, a site of meta awareness, and a very important part of connectivity to different areas of the brain. It is an emotional hub. We also found changes in SPECT brain perfusion, where the oxygenation of frontal lobes increased, and a huge amount of changes on neuropsychology in participants who received this Shakti Prava. After 3 months, what we found when we did their neuropsychology before and after, we found that they uh, cognition improved drastically. Their overall joyful state of being, it was clearly demonstrated that they were in a better state after having received Shakti Prava, and their ability to face challenges drastically improved, which is what they all shared. All the participants shared in that. And the same research, we took it further, the same process we researched further during COVID time, where we evaluated 420 participants online with the online process. And we did an emotional health score of these participants, where just to name a few important things which we found is the energy levels of people who took part in it improved, their bondedness with each other improved, and a very beautiful thing what was found in the female population of the second research is that their self-worth improved. Now, this is something maybe sounding very simple, but such an important thing when we see to live in society of how women actually feel themselves low, which is how society has brought up women. So this big result, I would say, is a very big achievement that their self-worth improved. So overall, I think this is something which we did, but then if you Google and see, there will be many, many articles across which will demonstrate that how spiritual practices and processes really, really help for mental health. And I would like to ask Veloraji and Kritiji next. What is your experience in the same? And then we can conclude. Veloraji?
Yes, thank you, Dr. Santosh Gupta. It's so helpful to hear this. And of course, this is again a very big area of interest for me. There is a growing body of literature and there's a growing understanding now, and I would say a paradigm shift actually in medicine, where people are moving more towards integrative medicine, where we are using not just our commonly known conventional medicine or allopathic medicine, but we are also integrating into that. And that's why the word integrative is important. So we're not getting away with one, but we are integrating a lot of different ways of healing, treatment, counseling for patients. And this is being accepted across the United States. The mind is open. I know doctors want to help, and we all come from the right space. It is just that we have often gotten cornered in this idea of evidence-based medicine, which is good, but there is a lot of evidence even in spiritual practices, spiritual processes. If we take a deeper look, I do think it is important to speak with someone and have guidance though, because oftentimes there are certain populations such as those who have severe depression or those who have severe anxiety. They need to work with their healthcare professional or somebody who can guide them spiritually, because not all meditations are safe, or contrary to what we understand. And that's why, just playing devil's advocate here, as much as I believe in the science of meditation, I feel it is important for people to have right guidance. And that is why we are all here, because we have walked paths, we have seen the benefit of our practices, the spiritual practices, ancient wisdom that comes from the Eastern philosophy, taking forward conventional medicine, which has advanced through research and science, and bringing them into one space, into one world, for the benefit of our patients and for those struggling with not only mental health issues, but also globally with other physical ailments as well. So thank you for shedding light on a very important topic. Yeah.
Dr.
Thank you,
Kirti?
Dr. Cecilia. Yes, I think for the conclusion, what I completely agree, and I think every one of us had these also deep experiences what spiritual practices can add to one's so-called normal life. And what I would invite everyone is just to be open, just to internally check if everything is perfect in life, then it's fine. But if we look around, I think a change is needed, and we are a part of that change. We cannot ultimately see ourselves separate from what is going on a collective level. So I think just being open to the idea and maybe just, giving it a chance, because ultimately it's and it will always be an experiential dimension. So many things that at least helped me from my personal experience. I didn't had the expectation that I would understand everything from a logical point of view, but I gave it a try, and I just looked at what does it do with me? Does it help me? Do I grow with it? Do I see a positive change and shift in myself? And maybe sometimes, especially for the more Western part of the world where we are very, rationally driven, just to give it a try, just give it a fair chance and just give that experiential dimension also, a try. And then if you see it brings a change for you, it becomes your reality. And as you said, it's all integrative. So for me, that experience was that what mattered most, because knowledge we do have a lot, but the knowledge doesn't necessarily bring the shift and the change. And this is what I see with the people I work with. There is a change. There definitely is a change. And this is why it should be given a try.
Thank you. Thank you so much. And to all our viewers, I would really like to take this opportunity. And again, I would like, other two doctors to also share last couple of lines. So from my side, I would like to say is that Mental Health Awareness Month is not just for namesake. Look for red flags in your own life, seek help as in where you can, and most importantly, uh, as we discussed, we are a social animal. We need to connect to people, talk to people. So be a part of the society as we are, and very importantly, try to incorporate some kind of a spiritual practice in your daily life, which will really help. Be open, talk to everyone. We have in Maitribodh Parivar, a very beautiful process which one can actually book online called as I Listen You. So expressing oneself is very, very important, which is going to be a huge part of treatment, part of mental health issues. So be happy, enjoy life, and we are here to help you for any kind of mental health issues. Velora ji, last line.
Yes, thank you, Dr. Santosh Gupta. And for me, I think my last parting thought is mental health is health. So please focus on that as well. And there is no space for judgment anymore. Everybody knows the importance of mental health. And so, wherever possible, express yourself. I agree with Dr. Santosh. The other is connection. So, we are all here to help. So stay connected with us. We are all here to guide, not just as doctors, but as human beings. So seek that with your friends, with your family, and open your hearts and express your heart. Thank you.
Thank you, Cecilia. Yeah, to add to that is just incorporate some spiritual practices into your life and find your ones. It doesn't necessarily need to be a meditation. It can be a walk, a regular walk in nature, connecting, with yourself, listening to your favorite music track and dancing to it, or baking a cake, or whatever makes you happy, but make every day a happy day. And that doesn't need 1 or 2 hours, also 10, 15 minutes. Taking time out for yourself, doing that what connects you with your heart, simply that what makes you happy, can bring a huge shift. So just start with that, and ultimately spirituality is about being natural. So just try to find that connection with yourself back, but take the time out for yourself. That would be my message. In today's time where we're also busy, it's important to also take a little bit time out and look within and see what is all happening there and what can I do to be happy. Thank you very much.
Thank you. Thank you, everyone. Thank you.